Joint pain getting worse with age? Top vitamins seniors should know, backed by science. Have you ever noticed that joint pain rarely appears all at once, but instead creeps in quietly, year after year as the body grows older? At first, it feels harmless, a little stiffness when you wake up, a knee that needs a few extra seconds to straighten, or hands that feel tight on cold mornings. Most seniors brush this off, telling themselves this is just what aging looks like. Friends say it's normal. Family members say, you're not young anymore. Even doctors often explain it as simple wear and tear. And almost always the solution sounds the same: pain relievers, anti-inflammatory drugs, or advice to take it easy. These medications may dull the discomfort for a few hours, but deep down, many seniors notice something unsettling. The pain doesn't actually stop progressing. Each year, the stiffness returns a little earlier in the morning. Each year, walking a short distance feels slightly harder. Each year, confidence quietly slips away. What many people don't realize is that joints don't fail simply because time passes. They fail because the internal environment that once protected them slowly changes, and often becomes nutritionally unsupported. After the age of 60, the body no longer absorbs and uses nutrients the same way it did in earlier decades. Even seniors who eat what looks like a healthy diet may be missing key vitamins their joints quietly depend on. This creates a dangerous illusion. You're doing everything right, yet your joints continue to hurt. Inside the joint, cartilage begins to dry out, joint fluid loses quality, and low-grade inflammation becomes constant instead of occasional. These changes don't cause sharp pain right away. They cause stiffness, hesitation, and discomfort that slowly reshape how you move through your day. Standing up from a chair requires more effort. Climbing stairs feels intimidating. Carrying groceries suddenly needs planning. Over time, many seniors adjust their lives around joint pain without even realizing it. They walk less, they sit more, they avoid movements that once felt natural. I've seen countless older adults take their medications faithfully, follow doctors' instructions carefully, and still watch their joint pain worsen year after year. The issue is not a lack of treatment. The issue is that aging joints require targeted nutritional support that is rarely explained clearly during routine medical visits. Certain vitamins play a direct role in protecting cartilage, calming inflammation, supporting joint lubrication, and maintaining muscle strength around joints. But most seniors are never told which ones truly matter, when to take them, or how absorption changes after 60. Instead, supplements are often taken randomly based on labels, advertisements, or well-meaning advice from others. Used incorrectly, some vitamins provide little benefit at all. Used at the wrong time, they may even worsen stiffness, sleep quality, or inflammation. But when used correctly, the right vitamins can dramatically change how joints feel during everyday movement. Not overnight, not as a miracle cure, but steadily, safely, and biologically. Today, I want to share the most important vitamins seniors should understand when joint pain keeps getting worse with age. These are not trendy supplements or exaggerated promises. They are science-supported nutrients that aging joints depend on to stay comfortable and functional. One of these vitamins is especially overlooked, yet it often makes the biggest difference in morning stiffness and daily mobility. Before we begin, take a moment and tell me in the comments, which joint is bothering you the most right now? Is it your knees, your hips, your shoulders, or your hands? And please stay with me, because once you understand what's really happening inside aging joints, you may look at joint pain very differently from now on. To understand why joint pain worsens with age despite treatment, let me share a story that mirrors what many seniors quietly live with every day. Thomas is 69 years old and spent most of his life being active and independent. For years, his mornings started with a short walk around the neighborhood. Nothing intense, just enough to keep his body moving and his mind clear. At first, the discomfort was subtle, a slight stiffness in his knees when he stepped out of bed. A few moments of hesitation before taking his first steps. He told himself it was normal and gave it no real attention. But over time, those few moments became longer. Standing up required support from the bed. Walking felt uncomfortable until his legs warmed up. Some mornings, the pain lingered longer than usual. When Thomas finally mentioned it to his doctor, the explanation sounded reassuring but vague. Mild joint degeneration, very common at your age. He was prescribed pain relievers and told to continue staying active. Thomas followed every instruction carefully. He took his medication daily. He never skipped appointments. He continued walking even when it felt uncomfortable. Yet each year, something felt wrong. The pain returned again and again, especially in the morning and after short walks. What bothered him most wasn't the pain itself. It was the hesitation that slowly crept into his movement. He began to question every step. He stopped walking as far as he used to. Not because he couldn't walk, but because he didn't trust his joints anymore. When we looked closer, Thomas wasn't lacking discipline, treatment, or effort. He was missing something far quieter and far more common. His aging body was no longer absorbing and activating key nutrients his joints depended on. Despite eating reasonably well and taking medication, the internal environment inside his joints had changed. Cartilage protection was weaker. Inflammation signals stayed active longer. Joint fluid quality declined. After adjusting the right vitamins, and more importantly, timing them correctly, Thomas noticed something unexpected. The sharp morning stiffness softened within several weeks. Standing up required less mental preparation. Walking felt smoother, not painless, but noticeably easier. For Thomas, the problem was never age itself. It was what his aging body could no longer support automatically. And Thomas's experience is not unusual. It's one version of joint pain, the slow, stiffness-dominant type that worsens quietly over time. But there's another type of joint pain that confuses seniors just as much. Margaret is 74 years old and struggled for years with pain in her shoulders and hands. Unlike Thomas, she had no obvious warning signs, no injuries, no physically demanding work. Yet simple movements triggered discomfort. Holding a cup, turning a doorknob, reaching overhead. Some days the pain felt sharp and sudden. Other days it was a deep ache that made her hands feel weak and unreliable. Medical tests showed no severe joint damage. X-rays looked acceptable for her age. This left Margaret feeling confused and discouraged. If nothing was wrong, why did everything hurt? She assumed joint pain was simply something she had to accept. She tried various supplements but took them inconsistently and without guidance. Some days she took them in the morning, other days at night, sometimes with food, sometimes without. After 60, the body processes vitamins very differently, even when doses seem reasonable. Margaret's joints were not just dealing with mechanical wear. They were affected by inflammation, nerve sensitivity, and declining tissue support. Once we corrected the vitamins involved in inflammation control, soft tissue protection, and nerve signaling, things slowly began to change. Her shoulder pain eased during everyday movements. Her hands felt steadier and more flexible. Most importantly, she stopped feeling like her joints were aging faster than the rest of her body. Margaret realized something crucial. Joint pain is not just a bone problem. It's a system-wide issue involving cartilage, fluid, muscles, nerves, and inflammation working together. Both of these stories share the same lesson. Stronger medications didn't solve the problem. More discipline didn't solve the problem. Targeted nutritional support did what symptom management could not. And that's because aging joints don't fail suddenly. They fail quietly, as several biological systems slowly lose support. In the next section, I'll explain exactly what changes inside your joints after 60, and why vitamins become far more important than most seniors realize. As we age, joint pain doesn't suddenly appear because something breaks. It develops quietly as several biological systems begin to change at the same time. One of the earliest changes happens inside the joint itself, in the synovial fluid. This fluid acts like oil in an engine, allowing bones to glide smoothly without friction. In younger bodies, synovial fluid is thick, elastic, and protective. After 60, its quality slowly declines. It becomes thinner, less lubricating, and less capable of protecting cartilage during movement. When this happens, every step creates slightly more friction than before. You may not feel sharp pain right away. Instead, you feel stiffness, especially after rest or in the morning. At the same time, cartilage begins to lose its internal structure. Cartilage isn't just padding. It's a living tissue made of collagen and specialized proteins that hold water and absorb shock. With age, collagen production slows down. Proteoglycans, the molecules that keep cartilage hydrated, decrease. As a result, cartilage becomes drier, thinner, and more vulnerable. This doesn't show up dramatically on scans at first, but functionally, joints begin to feel less forgiving. Small movements that once felt effortless now feel heavy. Another critical change happens at the inflammatory level. After 60, many seniors experience what doctors call low-grade chronic inflammation. This is not the swelling you see after injury. It's subtle, constant irritation that lingers in tissues. Inside joints, this inflammation quietly irritates cartilage, joint lining, and surrounding soft tissues. Pain becomes more persistent, even without obvious damage. This is why joint discomfort often feels always there instead of coming and going. What makes this worse is a change most people never consider: nutrient processing. Even if your diet hasn't changed, your body has. The stomach produces less acid. The intestines absorb nutrients less efficiently. The liver and kidneys become slower at activating vitamins. This means vitamins that once supported joint repair no longer reach tissues in the same way. Your joints may be deficient even if your blood tests look acceptable. This is one of the most misunderstood aspects of aging. Doctors often focus on structural damage, but joints rely heavily on biochemical support. Without the right vitamins, cartilage cannot repair micro-damage. Inflammation stays active longer. Joint fluid loses quality faster. Pain medications can temporarily block pain signals, but they do not restore lubrication. They do not rebuild collagen. They do not calm chronic inflammation at the root level. This explains why many seniors feel short-term relief but long-term decline. The pain returns because the joint environment is still deteriorating underneath. Another overlooked factor is muscle support. Muscles protect joints by absorbing shock and controlling movement. After 60, muscle strength and coordination naturally decline. Weak muscles force joints to absorb more impact. This accelerates cartilage stress and increases pain. Nerve signaling also slows down with age. When communication between nerves and muscles weakens, movements become less stable. The joint experiences micro-instability, small, repeated stresses that add up over time. This is why joint pain often comes with balance issues, hesitation, or fear of falling. What ties all of these changes together is one key idea. Aging joints don't fail because of one problem. They fail because multiple systems lose support at the same time. Cartilage, fluid, muscles, nerves, and inflammation are all connected. Vitamins play a critical role in supporting each of these systems. Without them, joints cannot maintain themselves. With them, joints regain a more protective environment. This is why vitamins matter more after 60 than at any other stage of life. They are not optional support. They are foundational tools that aging joints rely on to function comfortably. In the next section, we'll start breaking down the specific vitamins seniors should understand, beginning with one of the most misunderstood and underestimated of all. Number 1. Vitamin D, joint inflammation, bone support, and muscle strength. Vitamin D is one of the most misunderstood nutrients when it comes to joint pain in seniors. Most people associate vitamin D only with bones, but in reality, vitamin D functions more like a hormone than a simple vitamin. It directly influences inflammation, muscle strength, immune signaling, and how joints respond to daily stress. When vitamin D levels are low, the immune system becomes more reactive. Inflammatory signals stay active longer than they should. Inside joints, this creates a constant background irritation that makes stiffness feel persistent instead of temporary. Many seniors describe this as joints that never fully loosen up, no matter how much they move. Vitamin D also plays a crucial role in helping the body absorb calcium properly. Without enough vitamin D, calcium cannot be transported effectively into bone tissue. Bones surrounding the joint become weaker and less stable. When joint-supporting bones lose strength, cartilage and ligaments are forced to absorb more impact. This increases joint strain during everyday movements like walking, standing, or climbing stairs. Another critical role of vitamin D is muscle support. Strong muscles act like shock absorbers for joints. They stabilize movement and protect cartilage from excessive stress. After 60, vitamin D deficiency often contributes to muscle weakness, especially in the thighs, hips, and shoulders. When muscles weaken, joints are left unprotected. Every step places more pressure directly on cartilage and joint surfaces. This is one reason why joint pain and muscle weakness often appear together in older adults. Early signs of vitamin D-related joint problems. Many seniors assume vitamin D deficiency causes obvious symptoms. In reality, early signs are subtle and easy to ignore. You may notice increased morning stiffness without visible swelling. You may feel weaker when standing up from a chair. Your balance may feel less steady, even though nothing hurts sharply. Some seniors notice joint pain that feels worse in winter or during long periods indoors. Others feel more discomfort after rest than after movement. These are not random changes. They are early signals that vitamin D-dependent systems are struggling. Why vitamin D deficiency is so common after 60? After 60, the skin becomes far less efficient at producing vitamin D from sunlight. Even with regular sun exposure, production drops significantly. At the same time, the kidneys lose efficiency in converting vitamin D into its active form. This means seniors can appear normal on blood tests, yet still have insufficient active vitamin D at the tissue level. Digestive changes also reduce absorption from food and supplements. As a result, many seniors are functionally deficient without realizing it. Joint pain gradually worsens, and the connection to vitamin D is often missed. Common mistakes seniors make with vitamin D. One of the most frequent mistakes is focusing only on dosage. Many seniors increase vitamin D intake but see little improvement. The problem is not always how much they take. It's how and when they take it. Vitamin D interacts directly with circadian rhythm. Taken late in the evening, it can interfere with melatonin production. This disrupts sleep quality. Poor sleep increases inflammation and worsens morning stiffness. Some seniors actually feel stiffer after starting vitamin D simply because they take it at night. Another mistake is taking vitamin D without adequate fat. Vitamin D is fat-soluble. Without fat, absorption drops dramatically. Taking vitamin D on an empty stomach limits its effectiveness. A third common mistake is taking vitamin D alone without considering supporting nutrients. Vitamin D increases calcium absorption, but it does not control where calcium goes. Without proper balance, this can contribute to stiffness instead of relief. Why vitamin D matters more for seniors than for younger adults. Younger bodies compensate easily for short-term deficiencies. Older bodies do not. After 60, joints recover more slowly. Inflammation resolves less efficiently. Muscle rebuilding takes longer. Vitamin D helps support all of these processes. Without it, joint stress accumulates faster than repair can keep up. This is why joint pain often accelerates with age instead of staying stable. Vitamin D doesn't act like a painkiller. It does not block discomfort. Instead, it improves the biological environment joints depend on. Inflammation calms more effectively. Muscles provide better support. Bones regain stability. Over time, joints feel more reliable and less reactive. Proper timing and use for joint support. For most seniors, vitamin D works best when taken in the morning or early afternoon. This timing supports natural hormone rhythms and avoids sleep disruption. It should always be taken with a meal containing healthy fats. Consistency matters more than high doses. Vitamin D supports joint comfort gradually, not instantly. When used correctly, many seniors notice reduced morning stiffness within several weeks. Standing and walking feel easier. Confidence in movement slowly returns. For many older adults, correcting vitamin D timing is the first meaningful step toward improving joint comfort. But vitamin D does not work alone. In fact, without the next vitamin, its benefits can be incomplete. In the next section, we'll talk about a nutrient most seniors have never heard explained clearly, yet it plays a critical role in joint flexibility and long-term comfort. Number 2. Vitamin K2. Calcium direction, joint flexibility, and bone-joint balance. Vitamin K2 is one of the most overlooked nutrients in joint health, yet it quietly determines whether calcium helps your joints or harms them. Most seniors are told to take calcium. Many are also advised to take vitamin D, but very few are ever told what actually happens to calcium once it enters the body. Calcium is not automatically useful just because you swallow it. It must be directed to the right place. That is where vitamin K2 becomes essential. Vitamin K2 activates specific proteins that act like traffic controllers for calcium. These proteins guide calcium into bones, where it strengthens structure and stability. At the same time, they keep calcium out of soft tissues like cartilage, tendons, blood vessels, and joint capsules. Without enough vitamin K2, calcium can drift into places it does not belong. Over time, this misdirected calcium contributes to stiffness instead of strength. Many seniors experience joint tightness not because their bones are weak, but because calcium is being handled incorrectly. How calcium misplacement affects joint comfort. When calcium accumulates in soft tissues around joints, flexibility decreases, cartilage loses elasticity, joint capsules become tighter, movement feels restricted, especially after rest. This often shows up as morning stiffness that takes a long time to ease. Some seniors describe joints that feel locked or rusty rather than painful. This stiffness is not always visible on standard scans, but functionally it makes everyday movement uncomfortable. Standing up, bending down, or reaching overhead feels harder than it should. Vitamin K2 helps prevent this by maintaining the natural softness and flexibility of joint-supporting tissues. Why vitamin K2 deficiency increases after 60. After 60, digestive efficiency declines. The absorption of fat-soluble vitamins, including vitamin K2, becomes less reliable. Many seniors also reduce intake of foods naturally rich in K2. At the same time, vitamin K2 is rarely included in basic supplement routines. As a result, deficiency becomes common without obvious warning signs. Joint stiffness slowly increases, even in seniors who believe they are doing everything right. This is especially true for those taking calcium and vitamin D without K2. A common mistake: calcium without K2. One of the most frequent and damaging mistakes in senior joint care is taking calcium alone. Vitamin D increases calcium absorption, but vitamin D does not control where calcium goes. Without vitamin K2, increased calcium absorption may worsen stiffness instead of improving joint comfort. This is why some seniors feel no improvement, or even feel worse after months of calcium supplementation. The issue is not calcium itself, it is calcium without direction. Vitamin K2 provides that direction. Why vitamin K2 matters more for joints than most people realize. Many seniors focus only on bone density numbers, but joints depend on balance, not just density. Strong bones with stiff joints still lead to limited mobility. Vitamin K2 supports a healthy balance between bone strength and joint flexibility. It allows bones to be strong without sacrificing smooth movement. This balance becomes increasingly important with age, when tissues recover more slowly. Vitamin K2 does not reduce pain overnight. Its effects are gradual and structural. Over time, joints feel less rigid and more responsive. Morning stiffness shortens. Movement feels more natural again. Proper use and timing for seniors. Vitamin K2 works best when taken together with vitamin D. They complement each other biologically. Vitamin D increases calcium availability. Vitamin K2 ensures calcium is used correctly. Both should be taken earlier in the day with a meal that contains healthy fats. Consistency matters far more than high doses. Vitamin K2 works quietly in the background, supporting long-term joint comfort rather than immediate relief. For many seniors, restoring vitamin K2 is the missing link that explains why joint pain persisted despite calcium and vitamin D. But calcium direction and stiffness are only part of the joint health picture. Cartilage still needs strong structural support to stay resilient. In the next section, we'll talk about a vitamin that directly affects cartilage strength, tissue repair, and long-term joint recovery. Number 3. Vitamin C, collagen formation, cartilage protection, and joint recovery. Vitamin C is often dismissed as just an immunity vitamin, but for aging joints, it plays a far more critical role. Every joint in your body depends on collagen. Collagen forms the structural framework of cartilage, tendons, ligaments, and the connective tissues that hold joints together. Without adequate vitamin C, the body cannot produce or repair collagen efficiently. This becomes a serious problem after 60, when collagen breakdown naturally accelerates. As we age, old collagen fibers degrade faster, while new collagen forms more slowly. Vitamin C helps tip this balance back in the right direction. It supports the enzymes that build fresh collagen and maintain the strength of joint tissues. When vitamin C levels are low, cartilage loses resilience. It becomes less able to absorb shock. Small daily stresses begin to accumulate instead of being repaired. How vitamin C deficiency feels in daily life. Vitamin C-related joint problems rarely begin with sharp pain. They begin with a sense of fragility. Joints feel sore after normal activity. Recovery takes longer. A short walk may cause discomfort that lingers into the evening. Hands may feel weak or achy after simple tasks. Some seniors notice that joints feel tired rather than injured. This is a sign that connective tissues are struggling to repair themselves. Over time, this leads to stiffness, soreness, and reduced confidence in movement. The antioxidant role of vitamin C inside joints. Aging joints are constantly exposed to oxidative stress. Low-grade inflammation produces free radicals that damage cartilage cells over time. Vitamin C acts as a powerful antioxidant inside joint tissues. It neutralizes these harmful molecules before they can weaken cartilage structure. Without enough antioxidant protection, joint damage progresses quietly. Pain becomes more frequent. Movement feels less smooth. Vitamin C helps protect cartilage from this slow, invisible deterioration. Why vitamin C needs increase after 60? Even seniors who eat fruits and vegetables daily may not reach optimal vitamin C levels for joint repair. Stress, chronic inflammation, medications, and illness increase vitamin C requirements. At the same time, absorption and tissue delivery become less efficient with age. This creates a functional deficiency. Blood levels may look acceptable, but joint tissues still lack what they need. This is why joint pain can worsen despite a seemingly healthy diet. Common mistakes with vitamin C supplementation. One common mistake is taking vitamin C sporadically. Collagen repair requires consistent daily support. Occasional high doses do little to sustain tissue rebuilding. Another mistake is assuming vitamin C works instantly. Vitamin C does not reduce pain like a drug. It supports long-term tissue maintenance. Results appear gradually, not overnight. Some seniors also stop vitamin C too soon because they don't feel immediate relief. This prevents joints from rebuilding the collagen foundation they depend on. Why vitamin C matters more for seniors than younger adults. Younger joints recover quickly even with limited nutritional support. Older joints do not. After 60, micro-damage accumulates faster than repair unless collagen support is strong. Vitamin C helps slow this imbalance. It supports joint recovery after daily use. It helps tissues remain flexible instead of brittle. Without vitamin C, joints become vulnerable even during low-impact activity. This increases pain risk and accelerates decline. Best timing and use for joint support. Vitamin C works best when taken consistently, ideally earlier in the day. This timing supports collagen synthesis during periods of activity and repair. Dividing the dose can improve absorption and tissue availability. Vitamin C pairs well with other joint-supporting nutrients. It does not replace them, but strengthens the entire system. For many seniors, restoring adequate vitamin C quietly improves joint resilience. Movement feels less taxing. Recovery feels more reliable. Joints regain a sense of support rather than vulnerability. But joint comfort does not depend on cartilage alone. Nerves and muscles play a powerful role in how pain is felt and how joints move. In the next section, we'll explore a vitamin that directly affects nerve signaling, inflammation control, and joint muscle communication. Number 4. Vitamin B6, nerve support, inflammation control, and joint muscle communication. When seniors talk about joint pain, most people immediately think about bones or cartilage. But pain is not felt in the joint itself. Pain is processed through nerves. This is where vitamin B6 becomes far more important than most people realize. Vitamin B6 plays a central role in nerve function and communication between muscles, joints, and the brain. When B6 levels are adequate, movement signals are smooth and well coordinated. When B6 is low, nerve signals become distorted or exaggerated. This can make normal joint movement feel painful, sharp, or unstable even when structural damage is mild. Many seniors experience joint pain that is partly neurological rather than purely mechanical. How low vitamin B6 affects joint pain perception. When vitamin B6 is insufficient, nerves become more sensitive. Pain signals are amplified. Movements that should feel neutral suddenly feel uncomfortable or threatening. This creates a cycle of guarded movement. You move less smoothly. Muscles tense up to protect the joint. That tension increases pressure on cartilage and ligaments. Pain increases even further. Over time, joints become stiff not only because of tissue changes, but because the nervous system expects pain. Vitamin B6 helps regulate neurotransmitters involved in pain perception. It allows the nervous system to interpret movement more accurately instead of defensively. The connection between vitamin B6 and inflammation. Vitamin B6 also plays a role in controlling low-grade inflammation. Chronic inflammation irritates both joint tissues and nearby nerves. This irritation lowers the pain threshold. Joints feel sore even without heavy use. Adequate vitamin B6 helps support balanced immune responses. It does not turn off inflammation completely. It helps prevent inflammation from staying active longer than necessary. This reduces constant irritation inside the joint environment. Why vitamin B6 deficiency increases after 60. After 60, digestive changes reduce absorption of B vitamins. At the same time, many common medications interfere with vitamin B6 metabolism. This includes some blood pressure medications and anti-inflammatory drugs. As a result, deficiency becomes common without obvious symptoms at first. Joint pain may be accompanied by tingling, burning sensations, or weakness. Coordination may feel slightly off. Balance may feel less reliable. These signs are often blamed on aging alone. But in many cases, nerve support is lacking. How vitamin B6 affects joint stability and movement. Nerves control muscle timing. When nerve signals slow down, muscles react later than they should. This delays joint stabilization during movement. The joint experiences small, repeated stresses. Over time, this contributes to pain and wear. Vitamin B6 helps restore clearer communication between nerves and muscles. Movements feel smoother. Muscles support joints more effectively. This reduces unnecessary strain on cartilage and ligaments. Common mistakes with vitamin B6. One common mistake is ignoring nerve-related symptoms. Seniors often focus only on joint structure and overlook nerve involvement. Another mistake is taking vitamin B6 inconsistently. Nerve function depends on steady availability. Sporadic intake produces limited results. Some seniors also take vitamin B6 too late in the evening. Because B vitamins support energy metabolism, late intake may interfere with sleep. Poor sleep increases inflammation and worsens joint pain. Why vitamin B6 matters more after 60. Younger nervous systems adapt quickly. Older nervous systems recover more slowly. After 60, nerve irritation and inflammation linger longer without support. Vitamin B6 helps prevent this prolonged sensitivity. It supports coordination, balance, and confidence in movement. Joint pain feels less threatening. Movement feels more controlled. This psychological shift alone reduces stress on joints. Best timing and use for seniors. Vitamin B6 is best taken earlier in the day or early afternoon. This supports nerve activity without disrupting sleep. Consistent daily intake matters more than high doses. Vitamin B6 works gradually, improving how movement feels rather than masking pain. For many seniors, correcting vitamin B6 levels explains why joint pain never fully responded to painkillers. But nerve support, is still only part of the picture. Joint tissues also need protection from ongoing cellular damage. In the next section, we'll discuss a vitamin that quietly shields joint cells from long-term deterioration and chronic irritation. Number 5. Vitamin E. Cell protection, oxidative stress reduction, and joint comfort. Vitamin E rarely gets attention when seniors talk about joint pain. That's because its effects are quiet, gradual, and protective rather than dramatic. But inside aging joints, vitamin E plays a role that becomes increasingly important with every passing year. Aging joints are constantly exposed to oxidative stress. This stress comes from low-grade inflammation, metabolic changes, and reduced cellular repair capacity. Inside the joint, oxidative stress slowly damages cartilage cells, joint lining cells, and surrounding soft tissues. This damage does not cause sudden pain. It causes gradual weakening. Joints begin to feel irritated more easily. Swelling lasts longer. Discomfort appears after smaller amounts of activity. Vitamin E functions as a powerful antioxidant. It protects joint cells by neutralizing free radicals before they can damage cell membranes. This protection helps preserve the integrity of cartilage and joint lining tissues. How oxidative stress affects joint comfort. When oxidative damage accumulates, cartilage cells lose their ability to maintain structure. Joint lining cells lose their ability to regulate fluid balance. As a result, joints may feel dry, swollen, or irritated. Movement becomes less smooth. Recovery after activity takes longer. Vitamin E helps slow this process. It does not rebuild cartilage. It protects what remains. This is especially important after 60, when repair mechanisms are already slower. Subtle signs of low vitamin E in seniors. Vitamin E deficiency rarely causes obvious symptoms at first. Instead, seniors may notice joints that feel sensitive rather than severely painful. Discomfort may worsen after prolonged standing. Joints may feel warm or irritated without visible swelling. Some seniors feel that joints flare up easily and calm down slowly. These are signs that cellular protection is insufficient. Why vitamin E needs increase with age. After 60, the body's natural antioxidant defenses decline. At the same time, inflammation and oxidative stress increase. This creates a gap. Joint cells are exposed to more damage with less protection. Many seniors also reduce intake of healthy fats, which are necessary for vitamin E absorption. Certain medications and chronic conditions further lower vitamin E status. This makes deficiency more common than most people realize. Common mistakes with vitamin E use. One major mistake is taking vitamin E without fat. Vitamin E is fat-soluble. Without dietary fat, absorption drops significantly. Another mistake is using very high doses. Excessive vitamin E does not improve protection and may increase risks. Moderate, consistent dosing is far more effective. Some seniors also stop vitamin E because they don't feel anything. But vitamin E is not meant to create a noticeable sensation. It works silently, protecting joint cells over time. Why vitamin E matters more after 60 than before. Younger joints recover quickly from oxidative stress. Older joints do not. After 60, cellular damage accumulates faster than repair. Vitamin E helps slow this accumulation. It supports a calmer joint environment. This allows other nutrients like vitamin C and vitamin D to work more effectively. Without vitamin E, joint tissues remain vulnerable even when other vitamins are adequate. Best timing and use for joint protection. Vitamin E should always be taken with a meal that contains healthy fats. This improves absorption and effectiveness. Consistency matters more than dose size. Vitamin E works best as part of a long-term joint support strategy. For many seniors, adding vitamin E explains why joints feel less irritated and more resilient over time. It doesn't eliminate pain. It reduces the biological stress that keeps pain coming back. Now that we've covered the most important vitamins for aging joints, an even more important question remains. Why do so many seniors take these vitamins and still feel little or no improvement? In the next section, We'll talk about how vitamins are commonly used the wrong way after 60 and how those mistakes quietly cancel out their benefits. One of the most frustrating experiences for seniors is taking vitamins faithfully and still feeling joint pain worsen year after year. Many people assume this means supplements don't work. In reality, the problem is rarely the vitamins themselves. The problem is how they are used after 60. As the body ages, nutrient absorption, hormone signaling, and repair cycles all change. Vitamins that once worked effortlessly now require precision. When that precision is missing, even the right vitamins can quietly do nothing. Mistake 1. Taking everything at the same time. Many seniors take all supplements together, often in the morning or at night. This feels convenient, but it overloads absorption pathways. Fat-soluble vitamins compete with each other. Water-soluble vitamins may pass through too quickly. As a result, the body absorbs less than expected. Spacing vitamins throughout the day allows each nutrient to be used more effectively. Mistake 2. Ignoring timing and circadian rhythm. Timing matters far more after 60 than most people realize. Some vitamins interact directly with hormones that regulate sleep, inflammation, and repair. Taking vitamin D at night may disrupt melatonin. Poor sleep increases inflammation and worsens morning stiffness. Taking energizing B vitamins too late can also disturb sleep quality. When sleep suffers, joints recover more slowly overnight. Pain feels worse in the morning even when supplements are correct. Mistake 3. Using vitamins without their partners. Vitamins rarely work alone. Vitamin D increases calcium absorption, but without vitamin K2, calcium may worsen stiffness. Vitamin C supports collagen, but without antioxidant protection, repair is incomplete. Vitamin B6 supports nerve signaling, but inflammation can still amplify pain if other supports are missing. This is why single supplement approaches often disappoint. Joint health depends on a system, not a single pill. Mistake 4. Expecting vitamins to act like painkillers. Pain medications block pain signals. Vitamins rebuild biological support. These are very different processes. Vitamins do not work overnight. They work gradually, quietly, and cumulatively. Many seniors stop too early because they expect immediate relief. This prevents joints from ever reaching a more stable state. Mistake 5. Increasing doses instead of improving absorption. When results are slow, many people increase dosage. This often backfires. Higher doses do not guarantee better absorption. In some cases, they increase side effects or interfere with balance. After 60, absorption efficiency matters more than quantity. Smaller, consistent, well-timed doses often work better than large amounts. Mistake 6. Overlooking medication interactions. Many seniors take medications that affect vitamin metabolism. Blood thinners, acid reducers, and anti-inflammatory drugs can alter absorption or function. This does not mean vitamins should be avoided. It means they must be used thoughtfully. Ignoring interactions can cancel benefits or create new problems. What proper vitamin use looks like after 60. Effective vitamin use focuses on rhythm, balance, and consistency. Vitamin D and K2 work best earlier in the day with food. Vitamin C supports daytime tissue repair and circulation. B vitamins support nerve function when taken earlier, not at night. Vitamin E protects joint cells when taken consistently with healthy fats. The goal is not maximum intake. The goal is maximum usefulness. When vitamins are used correctly, joints often respond slowly but reliably. Stiffness eases, movement feels smoother, recovery improves, confidence returns. But even with perfect timing and combinations, there is one more misconception that keeps many seniors stuck. Many believe that walking alone is enough to fix joint pain. In the next section, I'll explain why walking is helpful, but often not sufficient, to restore aging joints. Walking is often described as the perfect exercise for seniors. Doctors recommend it. Families encourage it. And for good reason. Walking improves circulation, supports heart health, and keeps the body moving. But when it comes to joint pain after 60, walking alone is often misunderstood. Walking helps joints move. It does not rebuild what joints are missing. That distinction is critical. Many seniors walk faithfully every day and still feel joint pain worsen over time. This leads to frustration and confusion. If walking is good for me, why do my joints still hurt? The answer lies in biology, not effort. What walking actually does for joints. Walking increases blood flow around joints. It encourages gentle movement of joint fluid. It helps prevent complete stiffness from inactivity. These are important benefits. But walking does not rebuild cartilage. It does not restore collagen. It does not correct inflammation imbalances. And it does not strengthen weak muscles if nutritional support is lacking. Walking moves the joint. Nutrition maintains the joint. Without both, progress stalls. Why walking can sometimes make pain feel worse. In joints that lack proper lubrication, walking increases friction. In joints with weak muscles, walking shifts more load onto cartilage. In joints with chronic inflammation, movement can temporarily irritate tissues. This doesn't mean walking is harmful. It means the joint environment is not prepared for movement. Think of it like driving a car with low oil. Driving keeps the engine running. But without oil, damage still occurs. Vitamins provide that oil for aging joints. The missing support walking cannot provide. Walking cannot correct vitamin D deficiency. It cannot redirect calcium without vitamin K2. It cannot rebuild collagen without vitamin C. It cannot calm nerve sensitivity without vitamin B6. It cannot protect joint cells from oxidative damage without vitamin E. These processes happen internally, not through movement alone. That's why many seniors notice this pattern. They feel slightly better after walking. Then, stiffness returns. Morning pain persists. Confidence remains low. Walking helps circulation, but circulation alone is not enough. Why seniors blame themselves instead of the real problem. When walking doesn't help, many seniors assume they are doing it wrong. They push harder. They walk longer. They ignore discomfort. This often backfires. Pain increases. Fear of movement grows. Eventually, walking becomes something to endure instead of enjoy. The problem is not lack of discipline. The problem is missing biological support. How walking should be used after 60. Walking works best when joints are supported nutritionally, when inflammation is calmer, when muscles are stronger, when cartilage is protected. In this environment, walking becomes restorative instead of stressful. It maintains mobility instead of exposing weakness. Walking should support joint health, not carry the entire burden. When vitamins are used correctly, walking feels easier, steps feel lighter, recovery improves, confidence returns naturally. The real goal is not movement, it's resilience. Healthy joints are resilient. They tolerate movement. They recover after use. They don't punish you the next morning. Walking helps maintain this resilience, but vitamins help create it. That's why joint pain does not improve with walking alone. It improves when biology and movement work together. Now that you understand why walking isn't the full solution, the next step becomes personal. In the next section, I'll address the most common questions seniors ask once they start supporting their joints nutritionally, and the mistakes that quietly undo progress. Once seniors begin taking vitamins for joint pain, a new kind of frustration often appears. The pain doesn't vanish. Progress feels slow. Doubt creeps in. Many people begin asking the same questions, quietly and repeatedly. If vitamins work, why do my joints still hurt? This is the most common question of all. The answer is simple but often misunderstood. Vitamins do not erase damage that has accumulated over decades. They create a better environment for healing and protection. That process takes time. Joint tissues repair slowly after 60. Inflammation calms gradually. Lubrication improves step by step. Pain may still appear during this transition. That does not mean the vitamins are failing. It means the joint environment is changing underneath the surface. How long should I expect to wait before feeling improvement? Some seniors notice small changes within a few weeks. Morning stiffness shortens. Movement feels slightly easier, but deeper improvements take months, not days. This is especially true for cartilage and connective tissue. Expecting immediate relief often leads to disappointment and premature stopping. Consistency matters more than speed. Is glucosamine enough on its own? Glucosamine provides raw material for cartilage, but raw material alone is not enough. Without vitamin C, collagen cannot form properly. Without vitamin D and K2, structural support remains unstable. Without vitamin E, cartilage cells remain vulnerable. Without vitamin B6, nerve sensitivity may still amplify pain. This is why glucosamine alone often disappoints seniors. It lacks the biological support system joints require. Why do my joints hurt even though my scans look normal? This question confuses many seniors. X-rays and scans show bone structure. They do not show cartilage quality, joint fluid health, inflammation level, or nerve sensitivity. Joint pain often comes from soft tissues, fluid imbalance, or inflammation. These problems can exist even when scans appear acceptable for age. This does not mean the pain is imaginary. It means the problem is biochemical, not structural. Can I just increase the dose to speed things up? This is another common mistake. More is not always better after 60. Higher doses do not guarantee better absorption. In some cases, they increase side effects or disrupt balance. The aging body prefers steady, well-timed support over aggressive dosing. Improving absorption and timing usually produces better results than increasing quantity. Do I need to take these vitamins forever? This question reflects fear more than biology. Joint support is not about dependency. It's about replacing what the body no longer produces or uses efficiently. Some seniors eventually reduce doses, others maintain lower maintenance levels. The goal is not permanent supplementation. The goal is sustained joint comfort and independence. Why does joint pain come back when I stop? Joint pain returning does not mean vitamins cause dependency. It means the underlying support was removed. Just like stopping blood pressure medication doesn't cure hypertension, stopping joint support doesn't reverse aging biology. Support must match the body's current needs. Why didn't my doctor explain this? Doctors focus on diagnosis and acute treatment. Nutrition is complex, individualized, and time-consuming to explain. This does not mean doctors are wrong. It means their focus is different. Understanding nutritional support allows seniors to complement medical care, not replace it. The biggest mistake of all. The biggest mistake seniors make is assuming joint pain has only one cause. Joint health depends on many systems working together. Bones, cartilage, muscles, nerves, inflammation, and joint fluid all interact. Supporting only one part leaves the system unstable. This is why progress stalls despite good intentions. When the entire joint environment is supported, improvement becomes possible. Before we finish, there is one final step that makes everything personal, because joint pain is not the same for everyone. In the final section, I want to hear directly from you and explain how different joints often need slightly different support. Before we end, I want to turn this conversation back to you, because joint pain is never just a topic in a video, it's something you feel every single day. So take a moment and tell me in the comments, which joint bothers you the most right now? Is it your knees when you stand up or walk? Is it your hips when you sit too long? Is it your shoulders when you reach or lift? Or is it your hands when you grip, twist, or hold everyday objects? Your answer matters more than you think. Different joints often reflect different underlying stresses. Knees often struggle with muscle weakness and vitamin D imbalance. Hips are sensitive to inflammation and joint lubrication. Shoulders frequently involve nerve signaling and soft tissue support. Hands often reveal collagen loss and oxidative stress. When you share where you feel pain, the information becomes personal instead of general. I read the comments carefully. They help guide what I explain next and which nutrients deserve more attention. They also help other seniors realize they are not alone in what they're experiencing. Many people find comfort simply seeing that others share the same struggles. And often, patterns emerge that reveal solutions no one talks about openly. Now let's pause and reframe something important. Joint pain does not worsen simply because you are getting older. It worsens because aging joints are often missing the specific support they once received automatically. When cartilage dries out, when inflammation lingers, when nerves stay irritated, and when joints lose lubrication, pain becomes the body's signal, not its failure. Pain is not proof that your joints are worn out. It is proof that something is missing. The good news is this: even after 60 or 70, joints can still feel smoother, more flexible, and more reliable, not through extreme treatments, not through chasing pain relief, but through consistent, targeted support that matches how your body works now. Small changes made consistently matter more than aggressive fixes. Correct timing matters more than high doses. Understanding your body matters more than ignoring it. You don't need to give up movement. You don't need to accept pain as your new normal. You need to support your joints the way aging biology requires. In the next video, I'll explain one very common supplement many seniors take every day, believing it helps joints. But that can actually make joint pain worse if used incorrectly. It's something you may already be using without realizing the risk. Make sure you're subscribed so you don't miss that important explanation. And remember, your joints are not failing. They are asking for the right kind of support.